Hello friends, welcome back to Complete Medical Coding. Today let's discuss few practice questions from the CPT codebook. Friends, if you are new to the channel, please support me by subscribing to the channel. Let's move to the questions directly one by one. First question. An arterial catheterization is performed by cut down for transfusion. What CPT code is reported? Here you have to code for the arterial catheterization, okay, which is performed by cut down. So that word is also important. So when you will search for the codes, you have to make sure each and every word in the question you should understand. You should read it carefully, okay. So what is CPT 36600? Just open the code book. 36600. It represents arterial puncture, withdrawal of blood for diagnosis. This is catheterization, so not puncture. Now, what is option B? 36620. Arterial catheterization or cannulation for sampling, monitoring or transfusion. Yes, this is for transfusion only, right? But 36620 is percutaneous. What we need is cut down. So go to the next code 36625, which is cut down. So that is our answer. And if you check for the other code, option D 36640, that is arterial catheterization for prolonged infusion therapy cut down. Same cut down, but it is for prolonged infusion therapy, like chemotherapy. If in the question it is chemotherapy, then you have to code 36640. So here, as per the description, 36625. Okay, arterial catheterization is performed by cut down for transfusion. So the answer is option C 36625. Now second question. Transurethral resection of a 3 cm medium sized bladder tumor was performed in an outpatient setting. What CPT code is reported for this service? So here, what is the procedure done? Transurethral resection, and the size is mentioned 3 cm. It's a medium size, okay. Bladder tumor was performed. So take the first CPT 52234. Open 52234. Cystourethropy with fulguration including cryosurgery or laser surgery and or resection of small bladder tumor 0.5 up to 2 cm. Ours is 3 cm, and also this is not ours is 3 cm medium size. Here the size is mentioned as 0.5 to 2 cm. Cystourethropy. Yes, transurethral resection means cystourethropy. Okay. What is 52224 in option B? 52224. Cystourethropy with fulguration including cryosurgery or laser surgery or treatment of minor. This is minor, lesser size. So it means less than 0.5 cm. So that's also wrong. What is 52240? The same cystourethropy for the large bladder tumor. It doesn't mention the size, it just mentioned large bladder tumor. But in our question it's mentioned medium. So this is also wrong. What is 52235? Medium bladder tumor 2 to 5 cm, which is the exact size. As per our question, 3 cm. Medium, both are mentioned. So the correct answer is option D, CPT 52235 for the cystourethropy of 3 cm medium bladder size. Okay, medium size bladder tumor. Third question. A 30-year-old female delivered twins. The first is delivered vaginally and the second is delivered through C-section without any complications for both mother and twins. Patient needs to return back in 2 weeks' time for a postpartum visit. What are the CPT codes for this service? So here, the female has delivered twins. So the So we have to code for both the babies, right? The first is delivered vaginally and the second is delivered through C-section. It means there should be compulsory 2 CPT codes. And since this is a multiple procedure, right? Because one is through vaginal delivery and the other one is through C-section, we have to code it with modifier 51 because it's a multiple procedure. If both are delivered vaginally, then we will not use this modifier. Or if both are delivered through C-section, then we will not use the modifier. Since these both are different procedure, you have to code the second one with modifier 51. So let's look into the codes one by one. So as understood from the question, which is the complicated case? Cesarean delivery, right? C-section is complicated. So you have to always code for C-section as the primary code, primary CPT code, followed by vaginal delivery. And then you have to code it with modifier 51 because 51 represents multiple procedure. Here multiple procedure is carried out, right? So you have to first code for the C-section, okay, routine obstetric care, C-section, and then followed by the vaginal delivery with modifier 51. So this is a simple question, right? But you have to just understand the difference in each and every code, what is mentioned in the options. What is 59400? Routine obstetric care including antepartum care, vaginal delivery and postpartum care. 59400 is vaginal delivery. What is 59514? 59514 is cesarean delivery only, but you cannot code that because cesarean delivery has to come initially. What is 59409? Vaginal delivery only. What is 59510? Routine obstetric care including antepartum care, cesarean delivery and postpartum care. So this has to be coded first for the cesarean delivery. Routine obstetric care, antepartum and postpartum for the cesarean delivery. Because one is delivered cesarean, one is delivered vaginally, you have to always code for the routine care C-section first, then followed by the vaginal delivery. So code 59510 as the initial code, followed by the vaginal delivery code 59409, vaginal delivery only, okay, and append it with modifier 51. So that's how we have to code this one. Our correct answer is option D, 59510 for the routine obstetric care C-section and 594009 for vaginal delivery with modifier 51. Moving to the fourth question. Mary is having an intermittent abdominal pain, occasional diarrhea, stool frequency and bloating. Her symptoms have worsened over the past 2 months. Her physician orders a fecal calprotectin test to check for Crohn's disease. How will you code the lab test? So here, in order to check for the Crohn's disease, the physician has ordered fecal calprotectin test. Okay, and the patient is having, what are the complaints the patient is having? Abdominal pain, diarrhea, occasional diarrhea and stool frequency and bloating. So here, how will you code the lab test? That is what our question is. So you have to code only for the lab test. Okay. So what is this is a simple question. No need to go for each and every options. What is the lab test done here? Calprotectin test. So you have to just look for the code for the calprotectin test. Only one test is ordered. Fecal calprotectin test. So if you check all the codes, see 82270. 82270 is occult blood test. This is not occult blood. 82272 is again occult blood. It's incorrect. What is 83993? 83993 is fecal calprotectin test. Calprotectin fecal. That is what we need. As per the question, you have to code only for the lab test. So, what lab test is done? Fecal calprotectin test. So, the correct answer is option C, 83993. Okay. So, friends, hope you like this video. Hope you have hope you can understand all these 5 questions. If you come across any doubts or queries, you can mark it in the comments and I'll be replying back to you soon. So friends, if you like this video, please like and share, and if you are new to the channel, please subscribe to my channel. And thank you so much for all your support. See you in the next episode with more and more questions. Thank you. Bye. Take care.